First of all, Dr. Doc How, kasi ito, experience to ng father ko kasi he works is as a parang in a quasi-government lending cooperative for government employees dito sa Quezon City. Well, siya yung parang nagbabantay ng mga pumapasok doon sa mga pumapasok sa kanila kasi they're ano pa rin somewhat still they're operational. And yun nga, ano naman niya, tine-temperature check naman niya yung mga patients doon. Yung mga patients, yung mga customers doon. Tine-temperature check niya. Ngayon, tumawag yung boss niya and nagsabi na parang ano yata, na yung isang pumasok sa kanila in the past 4 days, na ano yun asymptomatic yun. Temperature check, okay naman. Regular, walang, hindi mataas yung lagnat. Pero in the past 4 days, biglang in-inform ng boss nila na yung pumasok kanila, thankfully wala yung father ko doon. Yung pumasok doon sa kanila, positive. So, there's an instance na yung mga pumapasok doon sa office nila, ano daw, asymptomatic pero positive. Hindi na detect nung temperature check. So, in effect, nakapasok yung individual na yon. So, question, how can we resolve this issue na we just temperature check yung person na hindi pala natin alam na carrier na pala siya ng virus. So, how can we resolve this? Kasi I think ganun din ang situation sa ibang mga kumpanya na basta na lang nag-check sila ng temperature pero hindi nila alam na carrier na pala ng virus. Does symptom check still work pa rin ba on these instances? Kasi we can't expect people to say na may close contact ako sa ganitong ganyan or what. Kasi hindi nila nararamdaman yung sakit eh. So, how can we resolve this, yung ganitong issue regarding sa pagpapapasok ng mga tao sa mga business establishments and offices?
Thank you, Red. No, and this is actually really something that happens naman and is a usual question frequently. No, so kaya po talaga the best is to really make it such that people don't need to go to work physically. No, so that's usually the first layer of protection. But if they do need to work to go to work physically, then another layer of protection, yung not letting anyone with symptoms or with fever to come in. No? But even with that, and actually even with testing, they are not 100%. At meron pa rin na posibleng maka-meet po or mag-ano ng criteria na ito. And that's why we have other layers of protection. The other layer of protection is improving the ventilation, having the engineering controls na may barriers, na may acrylic shields, naka-face mask, no? And then yung other administrative controls din such as yung pagti-team based. So kunyari if you will be exposed, then you have to always also just have very limited exposure to the same people, no? So that's something na ginagawa ng ibang tao or yung tinatawag din nila na sectioning, wherein very clear, kunyari, ito lang yung group of people that you will be exposed to para hindi na-expose yung other people in different floors, in different offices, etc. And then, of course, another layer din po of making sure that within the same offices, you should be observing the distance requirements, you should be wearing masks at all times, hindi kayo nagkakain together without the masks. No? So I think how I want to answer that, Red, is kaya po tayo maraming different layers. No? Especially for those who really have to go to work, then that is why we have to put in all of those additional protections for them to be able to maintain doing their work, but also do it very safely. And provided actually kasi that they do not meet any close contact requirement. So kunyari kasama nila sa office but they are always at the mask, they have that distance, they don't talk face to face unprotected, then hindi po rin sila considered na close contacts and less yung chance nila of being affected. No? So I think the way to answer that nga po is to ensure na those additional layers are always set in place, and to also have that the laxity then if there is that instance that happens, very quick yung contact tracing, very quick yung pag-isolate ng posibleng para there is no more further transmission.
Okay, sa DOLE kasi, what we always tell our workers is because of the asymptomatics that are positive, always presume. Kasi you don't know. Even you yourself, you will never know. So what we say is, why don't you presume that you may be a carrier or you are asymptomatic positive and those who you meet are asymptomatic positives, and you now take care that you will have all the protection you have. That's why the minimum public health standards are very important to us, especially because you have to physically report to work. The mask, the shield, the distance, the disinfection, because if you touch anything that could be contaminated, the best way to really remove this is to disinfect from our hands to surfaces that are frequently touched. And if you have to meet people, limit it to those that and limit the time with the full protection. Sabi nga ni Dr. Nika, it's there, the ventilation, if it's in an enclosed space, we're saying provide that additional strategy because the air that comes in should not be contaminated, and if there will be a contamination, it is brought out immediately so that there is a fresh air coming in, whether it is air conditioned or not. That's why the ventilation guidelines was really providing all of these mechanisms for for indoor air quality, good indoor air quality. And that would add, again, we can only go as far as reducing the risk. And when we reduce that risk, we can go back to work safely. It is hard. It is very hard. We get that question from the DOLE. People do not like to go back, but they're asked to go back. It is work. But what we're saying is, as long as the workplace does everything to ensure the safety of its people, and once that you have these positives, you lock down, you contact trace, you disinfect, then then you have people tested, and those who are again now negative or who have really no symptoms, then they will feel better in going back to work. But it is really a very difficult question. These things do happen, but what we can really do is really reduce to the lowest our risk of being infected.
Thank you po, Yusek Ruth.
Actually, yan. Actually, I agree with Dr. Nika and Asik Tess. To me, kasi all this is personal discipline. Diba, regardless of who you're with, regardless kung bigla silang, they will all of a sudden turn out positive. As long as you sanitize your hands and everything else that you touch, you wear your face shield, you wear your face mask, and you distance yourself from them at least 1 meter. Hindi ba sabi nila, I remember Yusek Rosette, at the onset of all this pandemic, she said that we can get at least 80% protection when we wear the mask. And then we get 99% protection when we wear the face shield. Tama ba, Dr. Nika? Do I remember it correctly? You wear the face shield 99%. Yung 1%, yun na lang yung mga hahawakan mo. So you need to sanitize your hands. So kung meron mag-turn out na COVID positive in your workplace, as long as you know that you do not remove all the medical devices that you need to wear and that you always distance yourself from them, then you have nothing to worry about. Yung office mo, kasi when you go to work naman, diba, lahat naman tayo either may desk ka or may workplace ka. If you're a cashier, meron ka, sanitize it. Just keep sanitizing it and your hands. So before you touch your face, any part of your face, kailangan malinis yung kamay. Yun lang po yung sa akin. That's personal. I'm just being very practical about all this. Kasi ang dami nating protocols eh. A lot of times, we also just have to use common sense. Isipin na lang natin ilang beses na paulit-ulit, 1 year na tayo, sinabi naman nila it's the droplet that cause the infection, that carry the virus. So you stay away from the droplets. That's all from... Sorry, that's not officially from DTI, that's personal.
Last question na lang po to kay Yusek Ruth. Ito lang po kasi of course you define na po ng IATF yung sinasabing ang outdoor outdoor dining in or yung alfresco dining na regulation sa IATF Resolution 104. Yeah, there were some restaurants na, yeah, may literal na outside. Pero meron ako isang nakita, I think it's on a news report, na merong mga mall or merong mga restaurant na nasa loob ng mall, pero ang ginawa nila, inalis lang nila yung upuan nila doon sa restaurant and minove nila outside the mall. Question, is that alfresco considered outdoor dining or kasi it's not inside the restaurant pero it's still inside the mall which is large. Unless siguro kung yung mall po is open air or yung merong siwang or talaga or natural air yung pumapasok hindi aircon. So how can we say na yung dining area is considered outdoor kasi baka may mga ibang mall kasi na or ibang restaurants kasi na baka ilabas lang yung mga table considered as outdoor dining na or alfresco dining na. Paki-clarify lang po yung rule lang po na yon. Salamat po, Yusek.
Opo, thank you, Red. Outdoor dining that we allow is yung may natural air. It's outside the enclosed area. If it's still within the mall that is enclosed, hindi po siya considered as outdoor dining. Yung alfresco, tunay na alfresco talaga, yung may natural air na walang pinto, walang bintana, yung open siya talaga. Yung marami pong question na ganyan doon sa mga fast food, di ba? Open yung sa fast food area. Hindi siya, yung mga pinto niya, hindi mo makikita kasi malalayo and it's a big space. That is not considered alfresco. Hindi po rin siya allowed. So, please let us know, Red, if you see any of those places, baka pwede para masabihan. Pero this is for the good of everybody po. At saka, another warning pala that I would always say, itong 2 weeks na to, di ba we are given only 2 weeks by the IETF. Yung applicability po and effectivity ng advisory number 21-03 ng DTI is only good until April 4. But of course, it will all depend on what's going to happen within these 2 weeks. Pagka po hindi bumaba ang COVID cases natin, we do not know what will be discussed in the IETF. We do not know if they will extend it or add more restrictions. Hindi po natin alam. Kaya it's a warning to everybody, both business and consumer, to please comply with all the health protocols that we are establishing right now para maipababa natin itong COVID cases natin.